Hi everyone, I'm Raj Kumar, President and Editor-in-Chief of DevX. This week we'll be breaking down the big headlines in global development and bringing in some top experts to help us do it. If you want to follow along with the stories we're talking about, check out devx.com and subscribe to our daily newsletter, The Newswire. There's a link in the description. Follow us along on Twitter and you can see many of the stories we're talking about today, and we'd love to hear what you think. This is This Week in Global Development. I'm joined this week by my colleague Sarah Jerving in Nairobi. Hey, Sarah.
Hi, Raj. Great to be here.
Great to be with you. And we've got a special guest. Anil Sani is with us, the CEO of the WHO Foundation. Hi, Anil.
Hey, Raj. Nice to be with you and Sarah.
Yeah, great to be with both of you. Hey, Sarah, I want to take advantage of the fact that your internet is coming through clear and you are sitting in Nairobi where there's a lot going on. Could you just tell us what's happening there on the ground?
There have been massive protests this week due to a controversial finance bill that has proposed tax hikes, and protesters have criticized the tax hikes, saying that the cost of living is already high for a lot of people across the country. So Tuesday was a big day of protests, and the parliament passed the bill, and protesters actually stormed Parliament. Following that on Wednesday, President William Ruto declined to sign the bill into law and has since withdrawn it. So we're still kind of the country is now operating on the 2023 finance bill. So it's been sent back to the legislature. So we will see kind of what moves forward and kind of how the people in the country react to that.
Yeah, well, I appreciate that overview because obviously Nairobi is a really important hub for the global development community, and lots of folks in our community either live there or travel through there or run and lead programs there. So I'm sure people have been tuning in to some of the news coverage. It's great to hear that you're there, you're safe, you're okay, and that you can give us a report on how it's all going. So I appreciate that, Sarah. Maybe we can dive into, I think one of the big themes this week is coverage around global health and taking advantage of the fact that we have Anil with us. You had a story, Sarah, all about the WHO Foundation itself. And Anil, I guess I'm assuming you had a chance to read that, and I'd love to hear your take on that piece, what you think we got right, anything you think we might have missed. What is this moment for the WHO Foundation in time? You've been there several years now. Where is the foundation in its trajectory?
Well, thanks for asking for the feedback on the piece. Sarah wrote it, and I give her tremendous credit for telling your readers what it's like to raise funding for the World Health Organization and why that matters. The WHO is the piston and the engine of global health. It is the organization that helps scale and accelerate access to new evidence, new technologies, and organizations around the world that are trying to improve health depend on a well-functioning WHO. Of course, the world was well aware of that during the peak of the COVID-19 pandemic, but it was true before and it remains true today. The foundation exists to do more to mobilize resources from the private sector for the World Health Organization. And resource mobilization, as you know, Raj, is challenging at the moment. It's a constrained economic environment, whether we're talking to politicians about government funding or executives about corporate support or philanthropists about charitable support. We have to convince them that it's a good investment making contributions to WHO. And our job as the WHO Foundation is to help our colleagues at WHO make that case and mobilize more money.
I mean, it's not mentioned in the piece, but since I've got you, I'd love to hear your take, Anil, on whether some of the kind of politicization of the WHO has hampered your efforts, because I imagine it can't help when there is all kinds of misinformation out there about the organization, and it's become more of a political issue in some countries than it ever was.
Well, You said it exactly right, Raj, which is there's a lot of misinformation out there, which is why we depend on people like you and Sarah to speak the truth in editorial platforms and news platforms about what the WHO is and what it is not. There are politicians around the world who are speaking to people's immediate needs, even thinking about the protest that Sarah described in Nairobi. People are in pain. They are having challenges in terms of paying their bills. And politicians, in order to get elected, reach out to people on an emotional level and say the things they need to win votes. And right now, there is a lot of rhetoric about us first, nation first, community first. Why would we give to others? And also about fiscal responsibility. Why are we spending money that we don't have to? And maintaining autonomy. And all of those things make sense. But when you think of WHO as contrary to any of that, that is what's false. And so part of what we have to do is make sure that we are speaking the truth and speaking to those concerns. If you think about people who think of health as a cost, it's actually an investment. And you know that well. In fact, often when you spend in the short term on health, you save in the long term. When you think about control, the pandemic accord, which the WHO hopes to pass now next year, no one's giving up control. The national governments maintain autonomy over their own countries. But what we are trying to do is say we need to share data, because the more we can share data, the more quickly and effectively we can get out in front of an outbreak. And that saves lives and that saves money. And so the more that we can explain why investments in WHO and in global health meet those very concerns that are driving the interest of constituents, the more I hope we can have a everyone under the tent approach to funding and support for organizations like WHO.
Yeah, I appreciate that. And Sarah, you wrote this piece. I have to say, I've known Anil for a long time. I've known the WHO Foundation, but there were some new things to me in there, things I didn't realize WHO Foundation was doing. What are some of the kind of the new things you found from the story that maybe go beyond people who just assume this is an organization that is just raising donations from the public? What else are they doing?
Yeah, I thought one of the interesting parts of our conversation was that the foundation takes over the administrative work and relations with the donor, and why that's so important to the WHO. WHO has been kind of burdened by having to do individual reports to donors. I think it's over 3,000 per year, and that's taking up staff time. And so I thought that was really interesting that the foundation works towards, that the donor relations and the reporting and tax deductibility and all of that. And then some other points that I thought were quite interesting, Anil. You had mentioned that the foundation wants to move more into big bet philanthropy and impact investing. And then also the conversations around how you can actually make more flexible funding from the private sector and kind of what that looks like.
Sure. So let me speak to a few to the very items that Sarah just mentioned. In terms of minimizing the administrative burden, Sarah mentioned a stat, which I'm going to repeat because it's shocking. The World Health Organization, which has 8,000 colleagues, most of whom are in country and region, and which has the budget at roughly $3 billion a year of the size of a single hospital in New York, spends a lot of its time and energy writing reports. So they receive small voluntary contributions or grants, and then spend a lot of energy, the energy of people who could otherwise be implementing programs, writing those reports and meeting the needs of donors. So when the WHO launched its investment round last month, and Dr. Tedros and leaders at WHO were joined by a number of high-profile supporters, including Gordon Brown and Mia Mottley. They emphasized that they want to mobilize both improved quality and increased quantity of funding. So as Sarah mentioned, one of the goals of the WHO Foundation is to make sure we can mobilize resources from a lot of different supporters, aggregate and pool them, and provide them to WHO as a model donor, as a donor that, of course, asks for accountability on the outcomes that WHO commits to, but does not trip WHO up with the requirement for a lot of administrative and financial reporting. That's one point. The second one that Sarah mentioned on big bet philanthropy or impact investment, we need to do more as a community in global health to show our donors that we're not competing for the very same dollar or pound or euro or franc. And one of the ways we can do that is by putting our resources behind showing how the puzzle pieces fit together to eradicate a disease, to get ahead of a health condition, and show that all of us need to participate. And so when we talk about big bet philanthropy, what we mean is to put out not a small request, but a big request for multiple organizations to accomplish an outcome that no single organization could do on its own. There was a third point there from Sarah, but let me take a breath, Raj, and turn back to you before I keep talking.
Yeah, no, that was great. I mean, it's a rare opportunity to get somebody with such knowledge of the piece on this podcast to talk about it. So I'm glad to take advantage of that. I'll take my own perspective. Is I remember when the WHO Foundation was created, and the thing I remember was the big target of we're going to get $1 billion in funding. And what I love about this approach, I mean, in some ways, it's like, well, it's been really hard to raise that money. You know, the amount that's actually been raised is far less. But I think the learning, maybe at least for me, is although $1 billion sounds like a lot of money, it's actually nothing in the scheme of things for an organization like WHO, which I think the latest replenishment round, investment round, is asking for over 11 billion in total. And what matters maybe more is the quality of that funding and the way it can be used to mobilize the public and other institutions around issues. So this idea that you just spoke about of using the platform of the WHO Foundation to generate a big bet. And, you know, maybe it's not all about money going through WHO itself. And in fact, I learned for the first time in this piece that the foundation can support other organizations like Gavi. Although you predominantly, you know, fund the WHO, I was interested to learn, you know, some of those details that were new to me. So no, it's great to have you take on those points, Neil, and I appreciate you doing that here. Maybe one more comment from you, and then I'd love to move to some of the other stories of the week.
One of the points that you just made that I want to reinforce is the fact that the total amount of money that goes to these institutions is relatively small. I think we all get sticker shock when we see a price tag of the billions of dollars, whether it's the WHO's target, whether it's the Global Fund's target, whether it's Gavi's target. But even if you add those three organizations up, what they're seeking to raise in any given year, first of all, is less than 25% of all of the money that's out there for development assistance for health, right? So these guys are important, but a small piece of the bigger picture. But the $40 billion in development assistance for health, all of the charitable and government money that goes into health every single year is 0.5% of total global healthcare spend. This is a tiny amount of money relative to how much we spend on healthcare. And what has always been true of healthcare, but what we must do a better job of convincing the public about, is the fact that it is an investment. When you invest early, you spend less over time, and that's both in terms of lives and dollars. To recall the topic that was every news story for years was COVID-19. And at that time, what we learned was that low vaccination rates in developing countries led to more deaths in high-income countries. That's a good example of why we need to invest more upfront so we save more over time. So absolutely, the goal that we have, of course we want to raise money, and we're still committed to a big target over time, but raising resources does take time. And I give credit to the organizations that have done so. Product Red for the Global Fund has raised not quite $1 billion, but a lot over 15 years. The French airline tax has raised an enormous amount for Unitaid. Those organizations do take time to raise money, but what they also do is build visibility and public support, because most of the money is always going to come from governments, but that government money is a lot easier to mobilize. And politicians say this themselves when they have the support of private sector organizations and leaders, whether it be philanthropists or executives. So that's absolutely part of our job. We have a specific target to raise 50 million in pledges for the WHO's investment round. That's a small portion of the global target for the WHO of an additional 7 billion for 4 years. But again, my hope is that raising those resources has a positive effect on the contributions from governments and the visibility of WHO and the trust in WHO, coming back to your earlier point.
Are you looking for the inside story on what's happening at organisations like the World Bank, USAID or the Gates Foundation? Then you need to be reading DevEx Pro. I'm Jessica Abrahams and I'm the editor of DevEx Pro. Pro is DevEx's premium news subscription where our expert reporters and analysts take you beyond the headlines, deep into the trends and institutions shaping the $200 billion aid industry. As well as all our news, you'll get access to conversations with global development leaders, resources to help you grow in your career, and a subscriber-only newsletter full of insider news and tidbits. See for yourself by getting a free trial today at devex.com/pro.
Well, while we're on this theme of raising money and talking about replenishments, maybe Sarah, you can give us a sense of what's happening at Gavi because they just launched their replenishment campaign. We covered it. Our colleague Jenny Lee Ravello wrote a piece about it. What do we know so far?
Yeah, absolutely. So they launched the replenishment campaign last week in Paris, asking for $9 billion, and that will fund their work between 2026 and 2030. Jenny also documented in her piece that kind of their new strategy for that period included some changes. So one includes a revised eligibility policy for middle income countries. So those that countries that reach a certain gross national income threshold enter into a phase where they receive reduced support and eventually graduate from Gavi. So that eligibility policy has been adjusted in this strategy. They will also be making a funding window available for countries that eligible for Gavi support but are experiencing a humanitarian crisis. And previously, there was no way for Gavi to engage with these countries. The board also agreed to the parameters around a $500 million first response fund for countries as a rapid response mechanism for emergencies. And that will be mainly used in the case of public health emergencies of international concern. They also launched the African Vaccine Manufacturing Accelerator, which we've covered recently as well. And that's a $1 billion financial instrument set up to support sustainable vaccine manufacturing in Africa. And that actually, the launch location of Paris received a bit of criticism from Amref Health Africa, who said it should have taken place on African soil rather than in Paris. But Africa CDC has promised that there will be a second launch in Africa with details to come around that.
Yeah, I was pretty impressed with this replenishment launch. I'd love to get your take on it, and just because there's been so much hand-wringing, certainly here where I live in Washington, D.C., about how Gavi was going to do this at a moment when lots of organizations are seeking funding in global health. It's a very tough political year, and I thought the approach they took was interesting, where they, instead of just saying, here's our request for funding, they actually used this moment to announce a lot of new, exciting, innovative initiatives that sort of address many of the challenges people would have brought up around Gavi in advance. Before they asked for funding, they said, we're actually launching a bunch of things that show we're growing and changing. And at the same time, they actually announced, quite a significant initial set of funding, including from the US, as part of this replenishment. So at least my take was fairly optimistic looking at this compared to some of the hand-wringing I've heard. What do you think about this replenishment launch, Anil?
I think Gavi did a terrific job, and it did a terrific job in the launch, and it's done a terrific job for the last 20 years. Gavi is credited as giving vaccines to 1 billion children and saving 20 million lives. So they have a strong track record. But I think what the Gavi team did, including the new CEO, Sanya Nishtar, who had a great interview with your colleague at DevEx, she got ahead of some of the very concerns that donors are going to ask. One of which is, what are we going to get for this money? Well, you're going to get 500 million more children vaccinated. Another one is, is there cost sharing with these countries that we're giving money to? Is this just a handout? And the answer is no. It's incredible that Gavi made this commitment that over the next 5 years, countries are going to fund more than 40% of the total cost of routine vaccines. That's a big increase from 15 years ago when it was just 10%. And they shared, as Sarah noted, that by 2030, more than 1 in 4 of the original Gavi recipient countries are going to be fully funding their own vaccine programs. So this is clearly an investment in a process over time where countries are doing more themselves. And I think it's anticipating those types of questions and also what you get in returns. It's an incredible figure. Gavi's replenishment launch said that they're going to get, it's almost hard for me to say this because a 10x return is already pretty good, but they said you're going to get $54 in economic returns for every dollar invested. So all of these initiatives and elements of describing not just what we're asking for, but what you're going to get in return will make Gavi's replenishment surely more successful.
Yeah, I think that's absolutely right. And I think, people were looking at what Sonia Nishar would do in this new role, and this has been a pretty important role to fill in the global health community. She's obviously a known name, but we didn't know exactly how this replenishment would go in terms of what it would include and how people would respond to it. And obviously, it's an evolving story, but it looks pretty positive so far. This is one of the big stories probably for the next 12 months is just covering how Gavi and other institutions, including your former home at the Global Fund, how they do in raising money in this tough political environment. Speaking of your background, Anil, at the Global Fund, not everybody listening may know, but you were a leader in the infectious disease space before taking this specific role at WHO Foundation. You used to lead infectious diseases at Viatris, a pharmaceutical company, and you had a long career at the Global Fund. We got a couple of big stories this week around PrEP for HIV, and I'd love to take the opportunity of having you to talk about this. But maybe first, Sarah, you can just tell our listeners what we learned, especially around this new PrEP trial for a 6-month injectable.
Yeah, so it's a major headline in the global health space. The trial results from Gilead's injectable PrEP, which prevents the transmission of HIV. And as you mentioned, it's a 6-month injection. And that's a major improvement from the products currently available. So their phase 3 trials showed 0 cases of HIV infection among the over 2,000 women that were given the drug. But of course,
that's a pretty crazy thing, right? Sarah, 0 infections, 100% success rate.
Absolutely, you don't see that often. And so, but after approvals, of course, for this drug, the next steps will be kind of ensuring widespread access across low and middle income countries. So that could take some time. Another story that we published is I was in Cape Town recently, where I visited the Desmond Tutu Health Foundation, and wrote a piece on some of the current PrEP options. And the foundation is doing some studies where they are examining the impact of choice on PrEP uptake. And they're doing that with funding from the Gates Foundation. And there are some issues with kind of the current option of the daily PrEP pill, which is the most widely accessible form of PrEP. And so this study is looking at kind of different delivery models for youth, like sending it discreetly in the mail or allowing them to pick it up at a mobile clinic, and then also giving participants choices of products. So the pill, vaginal ring, or a 2-month injectable. And they're anecdotally hearing that people like that kind of element of choice as opposed to a one-size-fits-all approach. But just it is worth noting that the injectable that is currently available for 2 months is not widely accessible right now. So Vive Healthcare has signed a generics agreement with the medicine's patent pool, but that's going to take some time to come into fruition in terms of manufacturing. So it is likely that this 6-month injection is a ways away from kind of being widely accessible in low and middle income countries. But exciting news nonetheless.
Yeah, I think so. And certainly when you think of where the HIV problem is growing, where the biggest challenges are, which is often in adolescents and especially girls. And I guess, Anil, you've been working on this a long time, but it seems like having these PrEP options, thinking about choice, thinking about how to reduce stigma, and maybe even the potential somebody could take a shot every 6 months and they could be protected. That seems like a kind of a game changer. I don't know. What's your feeling about it, Neil?
I am so excited about this new data. The 2 stories that DevX published this week tell a very linked single story, which is that there's an incredible need for us to blunt new HIV infections. And while we have a technology that allows us to do that, PrEP, taking an oral pill has significant constraints. And what we've seen in contraception, there was a terrific front page story in the New York Times earlier this month that looked at contraception rates increasing because, exactly as Sarah said, of choice. We see a lot more women using implants and injectables for contraception rather than pills. And there are clear reasons for that in terms of the visibility of taking a pill and the challenges, the inconvenience of taking a pill. And I hope, and I think as Sarah said, the data so far, and certainly the anecdotal evidence, is that we will see the same in HIV. And as we can move to products like injectables, particularly a 6-month injectable, I hope we will see in HIV prevention what we have seen in contraception, which is more choice and empowerment for women and girls and higher rates of taking these products and therefore more lives saved.
Yeah, I mean, you think about the difference between an every 6-month injectable versus having to take a pill every single day. And as I think a lot of the young people told you, Sarah, in Cape Town, if you think about the stigma associated with it, they were mentioning that sometimes the vial or the container that contains the PrEP pills looks the same as the container for antiretroviral treatment for HIV, and so there might be stigma that people think they have HIV. Then they have to take it in front of their parents, who that might signal to them that they're sexually active. So the pills, while itself is a huge revolution and it saved so many people around the world, PrEP daily pills have been really important and as an innovation. But nonetheless, the delivery mechanism really matters, and it could really change things, especially for these populations.
Yeah, and one thing that was mentioned to me in Cape Town was some of the peer youth advisors said that young, like teenage girls and young women, are used to, as Anil mentioned, kind of with the contraception example, are used to injections from contraception. So there's kind of that familiarity, whereas there's these obstacles with the pill, and there's also some hesitations for some people around the vaginal ring.
Right. Yeah, that's good to pay attention to. We're running short on time, as there's been a lot of headlines this week, but I wanted to just get to a piece that you wrote, Sarah, about a summit that took place in Baku in Azerbaijan. Obviously, it's getting people's attention because of the fact that that's where the COP is going to be soon. And this is a summit that was talking about climate and health, a nexus. Anil, I know you and I have talked about, and it's very much on people's minds these days in the global health community. What was this conference all about? What did we learn from it?
Yeah, so a big part of these conversations were around keeping up the momentum and solidifying the place of health on the climate change agenda. So last year at COP28 in Dubai, there was the first dedicated health day at COP, and that led to increases in pledged money and political commitments. But conference attendees in Baku spoke about the need to push that momentum towards actual in-country action. So one element of this is kind of getting health ministers more involved in conversations around climate and working to integrate climate data into health work, which helps in areas like planning for outbreaks in countries. And then a huge part of the conversation was also around climate finance and making it more accessible to health actors. So only 2% of adaptation funding and 0.5% of multilateral climate funding is funneled towards projects that are focused on health. But it's estimated that low and middle income countries need at least 11 billion annually to adapt to climate's impact on health. But one of the big conversations was how countries have found it daunting to figure out all the different requirements of different funding institutions. So a country may need to tap into different options like grants from one institution and debt from another. So financing institutions are actually coming together to coordinate to try to make kind of accessing funding more seamless. And they're analyzing their own investment frameworks and in terms of investing in climate and health and comparing with one another and trying to figure out where they overlap and work to make it more straightforward for countries that are seeking help. And there are also new partnerships in that space. So the Global Fund is working with both the World Bank and Green Climate Fund to co-finance climate and health projects.
Anil, what are you seeing in this space of climate and health? I'm sure you had a look at this story, but I don't know if you were in Baku yourself, but what's your sense about how this conversation is evolving?
I think, as Sarah is pointing out, the rhetoric is moving in the right direction, but I don't know that the funding is keeping up. And what was said at the summit, and what has been said, particularly since the Health Day at COP last year, is that health is the human face of climate change. This is not a narrow overlap. What we are seeing, and it's not years in the future, is an enormous amount of mortality and morbidity, 7 million deaths due to air pollution each year, associated with climate change. And this is coming back to our earlier discussion about how we motivate funding. We must see this as an issue of interdependence. The cholera outbreak and burden in Malawi has been linked to the floods in Pakistan. We're seeing increased temperatures resulting in far more cases of dengue, 10x the burden that we've seen in the past in countries like Brazil. We're seeing an increase in malaria. All of these effects essentially are showing us that the change in climate is being experienced not by, as Martin Endlet, a good friend, said at the conference, by polar bears in the Arctic, but by human beings, by our neighbors, by our family members. And when that's happening anywhere in the world, it's going to have effects everywhere in the world. So that logic, that argument, I think is quite strong. We need to keep repeating it, and we need to repeat it to those who control the purse strings. Whether or not there's been enough funding, I think the verdict is clear. There's not nearly enough money out there to fund the interventions for climate mitigation and adaptation that the world needs. And that's where we need to be much more effective at explaining the investment thesis, that by mobilizing those additional resources now, even in an economically constrained environment, we are saving money over time. That's why we buy insurance. I buy insurance so that I make sure when there's a flood that hits, I'm covered. It's that same rationale of self-interest and investing now for future savings, for future shocks, that needs to motivate much, much more money at that intersection of climate and health.
Yeah, so well said. And at least for me, as I think about the conversations that I've been a part of, there's such a desire in the health community to figure out how do you take the energy, momentum, and money that's moving into the climate space and get at least some of that focused on the health aspects of the climate crisis. And I think part of it is what Sarah referred to, and it's referred to in the piece, is a lot of that funding in climate, a lot of that energy is around the idea not of grant funding, but of investment. And how do you think about health projects as being investable and even bankable? And I think that's the thing the global health community has to grapple with a bit, is a different way of talking about and framing its work to appeal to this new climate agenda. But it is exciting to see organizations like the Global Green Climate Fund, partnering now with the Global Fund and with the World Bank. Like, you're seeing some of the right players getting together, even if it's fairly early. And I think that's an important sign that progress is being made. And obviously, this is a theme we'll continue to cover in the lead up to Baku, this winter. Listen, it's been great having you here, Anil. I really appreciate you being on this podcast this week, and you, Sarah, being there on the ground in Nairobi. It's been fantastic. I do want to just say a big thank you to our listeners who are DevEx Pro members, because we are coming up on DevEx Pro Week, which is a special week where we really highlight the benefits of being a member of DevEx Pro, which is our premium subscription for all the news we produce here at DevEx. And we've got a whole bunch of special things for those of you who are subscribers. Just yesterday, I interviewed Scott Nathan, the CEO of the Development Finance Corporation. Those recordings are available to our DevEx Pro members. We've got a bunch of other events coming up, and there's even a new downloadable we've created all about probably the hottest topic of the day, which is localization, a topic that just sticks around and continues to drive a lot of interest. So thank you if you're a DevEx Pro member. If you're not, this is a great time to sign up because there is a discount being run during Pro Week. You could just go to the devex.com website and look up DevEx Pro and learn all about it. And thanks to all of you for listening in. And thank you, Anil. Thank you, Sarah.
Thanks, Raj. Thanks, Sarah.
Thank you both. It was great chatting.
This has been This Week in Global Development. If you enjoyed this episode, don't forget to subscribe using the link in the description. To get even more coverage and analysis on the most pressing development issues of the day, become a DevX Pro member by going to devx.com/membership and signing up. Thank you for listening, and see you next week.